Hello everyone, Drew Watts back. I'm the Business Development Manager for Restorative Oxygen Care, back again with Dr. James Collier, our Medical Director.
Hello again.
And Dr. Collier, what is it exactly that HBOT does? Why do patients come to see us for HBOT?
Patients usually come to see us because they have a condition that is painful or open and draining, or the skin is broken and won't heal.
Okay, so those things like inflammation, infection, and obviously those are some things that we see often, right? Explain briefly how HBOT treats those things, and then maybe a little bit about the angiogenesis, the growth of blood vessels.
Okay. So the whole point of hyperbaric oxygen therapy is to get more oxygen into tissue that is injured in some way, because oxygen helps reduce inflammation, reduce injury, repair tissue that has been injured.
Okay, so in cases of inflammation, like we might see in a rheumatoid arthritis,
Yes.
HBOT can significantly help reduce some of the inflammation.
Right. There are studies that show that the erosive changes of rheumatoid arthritis do actually reverse in the presence of hyperbaric conditions. That is, we are actually truly healing the inflamed tissue by calming the inflammation.
Excellent.
And allowing the body to take its own action.
Sure. And so explain this angiogenesis, or the growth of new blood vessels. I mean, I think that's one of the coolest parts about this technology. Explain a little bit, if you can, about how that works and why it's so important.
So blood gets to our body tissues finally through capillaries, very fine, very small blood vessels that carry red blood cells literally one after the other. There's only so many of those in the body naturally, and in harmed tissue they have been reduced as a rule. The presence of so much oxygen causes the body tissue to wake up and make more blood tracks for this hyperoxygenated blood to arrive. So it actually creates more capillaries where capillaries have been damaged and destroyed.
Right, and so like we see a lot of patients who have ischemic tissue.
Correct.
How does that angiogenesis affect that ischemic tissue?
Well, ischemic tissue simply means it does not have enough oxygen. So what we're trying to do is bring more oxygen normally. So somebody's in a hyperbaric chamber for 2 hours a day. That's only 2 hours a day in which you're getting more blood. But the body learns to adapt to that and figure out, I need more blood all the time. How can I do that? Make new blood vessels so more blood comes to the tissue.
That's fantastic. Well, and a lot of times we will work with, say, a vascular surgeon if we need to help improve some of those specific cases. But it just shows another way that hyperbaric oxygen therapy can benefit the patients and improve their outcomes as part of a team approach to improving outcomes.
Absolutely.
All right, well, thank you again so much for your time today. And if you have any questions, if you're looking for more information about hyperbaric oxygen therapy, please call us at the number below or check out the website and you can reach us there.